Hello, it's Sue Croft here. Your physiotherapist has decided that it might be worthwhile trying a pessary fitting for you. I'd just like to go through a few things before you have that fitting so you understand some of the difficulties that may be involved with fitting a pessary. Sometimes pessaries are very easy to fit, and we know that when we're in the consultation. We know there is a very good muscle shelf, the levator muscles are intact. We know there is a nice prominent pubic notch where the pessary has the opportunity to hook in behind. But we also know sometimes during the assessment that there is significant levator muscle injury. So there may be a partial or complete avulsion on one side or both sides, and this really contributes to some difficulty with fitting the pessaries. As I said, having a reasonable pubic notch to hook the pessary in behind, particularly if there's an anterior wall prolapse, is also one of the difficulties that may arise when you're having the fitting. But we also can't definitively say that, it's actually no point in doing it. We actually always like to give people the opportunity to have a go at fitting a pessary. The physiotherapist cannot always say if you've going for a fitting whether you're going to have to try 1 or 2 or 10 pessaries. And of course we're always very equally distressed when we can't make pessaries work. So it is important to understand that sometimes your physiotherapist can't just definitely say yes, it's going to be fine, we will find one. It is really trial and error, and we have a large range of pessaries for you to try. We are able to allow you to sometimes utilise a pessary for a week to see if it's going to work, but these only are the CPOP pessaries, and in very small opportunities to try some other pessaries. We can't let rings go out, we can't let cubes go out. So we do need you to understand that when you're going for your walk with your pessary, you have to be certain that it's not dislodging and that you're happy with it, because once we sell you the pessary, it will have to remain purchased, and we are unable to do anything about that. And that's why we try so very hard. We get you to jump, we get you to squat, we get you to do things that you've probably not done for quite a few years. And so it is important to say that that's so we can see, is the pessary likely to dislodge once you walk out of the practice. If you are having any urinary leakage issues as well as prolapse, this becomes even more difficult, because some pessaries do help stress incontinence, other pessaries just help prolapse, and it's very hard sometimes to get something that will work with both. Again, it's trial and error, and I hope that you will be patient and really persevere. If your physiotherapist is suggesting it's definitely worth having a go at some other pessaries, but perhaps it has to be at a second appointment and sometimes even a third appointment. You will require local estrogen if you're having a pessary and you're postmenopausal or you are breastfeeding. So we cannot let you have a pessary without that, otherwise this could cause some wearing of the tissues and abrasion. It may cause bleeding. We give you forms to fill in and to abide by, and these ask you that if you're getting a pessary fitted, you very soon after the pessary fitting you'll have a bimanual examination and a speculum check from your GP to make sure everything is healthy in the vagina before we start. And then at 12 months, every 12 months, when you're wearing a pessary, you need to have a speculum check. The manufacturers advise us that you should be having a new pessary every 12 months, so that's why we make recall appointments. We take pessaries very seriously, and that's why we ordered our pessaries, and you will receive letters from us so letting you know that you perhaps are overdue for your 12-month replacement. This is so that we can prevent complications, which can be very serious, and we don't want serious complications with your pessary. We don't want any complications. Pessaries are life-changing if they fit, and I really do hope that when you have your pessary fitting, the physiotherapist you are seeing is able to make one work, and you're able to have a successful relationship with that pessary and changing your life, allowing you to exercise more freely and with gay abandon. Thank you.